start today, Mitch will share some history from Intermountain's roots in the community, as well as provide a state of the hospital address, including the major innovations, benchmarks, and national healthcare outcomes, and other improvements made at the St. George Regional Hospital. Please welcome Mitch Cloward.
Thank you for allowing me to spend some time with you here. I've got two microphones. Can this one, sir? I have to have both. Okay. All right. I appreciate you inviting me to be here with you this afternoon and to share a few of my thoughts about healthcare and Intermountain Healthcare and health in general. But I have the opportunity to visit our patients in the hospital. And that is one of the most rewarding things that I can do in the course of my day. But it reminds me every time that I do visit our patients that one of the greatest gifts that we have is our health. So I hope you take a moment now to reflect on your own health, and are you taking time to care for yourself? And that occurs in so many different ways. Are you getting time away from work, to disconnect from work? Are you doing things that you enjoy that are healthy? So much about our health is within our own control. The other thing that I like to talk about the importance of is I have a primary care physician. And once a year, I schedule an appointment with my primary care physician, and he orders labs and blood tests, and there's things happening inside my body that I would never know had I not got those lab results. So make sure you establish yourself with a primary care physician. You're proactively addressing your health that way. Make sure you're taking time for yourself and finding meaningful ways to exercise. There's so many different ways to do that here. And step away from all the work that consumes our days. So I think that there's probably not a more important message that I can share with you today than the importance of taking care of yourself. Hope you do that. And if you want a different perspective, I'd be happy to have you join me in visiting our patients in the hospital, and I'm sure that would inspire you to start thinking about your health. All right. So when you're driving down the freeway, down I-15 here or anywhere across the country, and you see this blue H sign, it's universally represented as a hospital. But I think something else you also need to recognize is that not all hospitals are created equal. And we'll elaborate more about that here in the slide presentation today. But I want to talk a little bit about Intermountain Healthcare, how it all began, and because of how it all began for Intermountain Healthcare, how it all began for Intermountain Healthcare here in St. George with a hospital. I thought that history might be helpful, and I want to thank Terry Draper and our team here from Marketing Communications for helping put this together. It's wonderful information. So, in 1975, the Church of Jesus Christ of Latter-day Saints decided that it no longer wanted to be in the business of healthcare. It's a worldwide organization, and providing hospital care was not in the scope of its mission. So a not-for-profit entity was established that became Intermountain Healthcare, 1975. And so it was the presiding bishop, Victor Brown, as I understand, in 1975, he gave this newly formed organization a commission and a charge by saying, become a national model healthcare system. So I was recruited here from Dallas, Texas, but in the healthcare circles, people know about Intermountain Healthcare, and its name is synonymous with the Mayo Clinic, the Cleveland Clinic, other healthcare organizations nationally and globally that are recognized. There's not a brand that's recognized more nationally and globally than Intermountain Healthcare. And we have the fortune of having that here in our backyard. So that was the commission from the presiding bishopric to Intermountain Healthcare, become a model healthcare system. And so then in 1976, we started talking about a hospital here in St. George. And so that was about a year later. And many of you may know Dave Jepson. Dave Jepson passed away here in St. George in April, but he was an executive vice president for Intermountain Healthcare in Salt Lake. And he came down here in 1976 to talk to the county commissioners about the hospital here. And the county was consumed with funding jails and roads, and they didn't think they were the best entity to be running a hospital. So they were entertaining another hospital system to come in here and purchase and acquire the hospital from the county. That's where Dave Jepson comes in as the executive vice president, and he tells this story of how it all began. In 1976, there was an amazing act. That act was a handshake between two great individuals who had a lot of integrity. That act was performed quietly and without ceremony. Each individual represented their organization in a way that would shape the future of healthcare. And no one could have known that it was a handshake and a promise that would define healthcare for our region.
In the early part of 1976, we've been just about a year in getting Intermountain Healthcare started. I was told that an investor-owned company had come down and been talking to the county commissioners here. And when I came down, I said, I understand you guys are thinking about selling the hospital. He said, we don't want to ever go through another major hospital project like we've just been through. It's just drainage. We need to build a new prison. We've got some streets and bridges that need to be repaired. And this other company has offered us several $1 million. And we thought we ought to come down and just see what you'd be willing to do with us, and whether or not you'd be an officer we'd look at too. Told them about our mission statement, how we felt about the employees, and how we valued them, and how determined we were to keep costs as low as possible, and really work hard on quality, and try to make this system really become one of great reputation. And so that's what I bring, gentlemen. And this is probably going to be bad news for you, but let me just ask you, do you have any debt on this hospital you just built? And they said, yes, we've got a bond we've got to pay out. All I can offer you is everything that you have put into the hospital, including the unpaid debt. We'll take the balance sheet for the hospital alone, but we will not take the balance sheet, can't, for what you're needing for prisoner bridges. But I thought that's the end of that conversation. And then finally I got a call not too many days later, and they said, we thought over what you've shared with us, and we want you to come, but if you're going to do it, they've got to have some assurances. And Murray Webb said, how do we know that you're not going to come down here and just be a laid-back organization? And I said, well, I can give you every assurance that we'll do what's needed here for the community. We'll bend over backwards to meet those needs. When I came down, Murray said, are you willing to promise me, Mr. Jepson, that you will expand the services to keep the quality and keep the cost as low as possible? And I said, absolutely. He said, you just acquired a hospital. And I said, that's great. And we keep the promises.
Now here we are, half century later, and we have world-class healthcare. We have lived true to the promise of becoming a model healthcare organization. Independent national media like U.S. News and World Report and Newsweek rank St. George at the top.
At St. George Regional Hospital, we have really grown a very comprehensive and robust cardiovascular program here. And this includes what's termed structural heart. Essentially what that is what was traditionally reserved for open heart surgeries. Many of these patients now can have much more minimally invasive approaches. Other metrics that we look at when we're measuring our success of how well we're taking care of our patients with the community is how often you're having to come back into the hospital. So we look at readmission rates. And each one of these categories were well below the national average for readmission rates. when somebody comes into the hospital, we typically have a short period of time to actually get into their heart. We're considerably, significantly better at doing that as far as time with door-to-balloon time than the rest of the country, when we look at national averages.
Here in Southern Utah, we're doing amazing things with stroke. We have excellent stroke care here at St. George Regional Hospital. We are a Joint Commission certified primary stroke center. Once again, the American Heart Association has recognized us for top stroke care. In stroke care, time is brain. When a patient comes to our hospital, we work really hard to make sure that they get the treatment they need quickly. We are well below the goal times for imaging and treatment for stroke care, and we provide that care extremely quickly. At our hospital, we have capabilities to care for stroke patients that aren't available at other hospitals in the area. If I had a family member who had a stroke, this is where I'd want them to come.
In neurosurgery, we offer amazing care for our brain and spine patients. With neuro-oncology, we have been the first center to offer intraoperative MRI so that we can actually have an MRI scan of the patient's brain, especially with tumors, during surgery. We also are the only center that uses gliolin, which is immunofluorescence, where I'm able to see tumor tissue versus brain tissue while I'm doing the operation, and that allows me to be more successful in actually removing the brain tumor, which improves patient outcomes. We're also a spine center of excellence for cervical and lumbar spine surgery, and have been for the last 6 years. We've received multiple national awards, and I'm proud to be part of a team that offers the very best in brain and spine care.
The Women and Newborn program at St. George Regional Hospital offers comprehensive services, including a 24/7 pediatric lifeline service, a 24/7 neonatal lifeline service, a simply birthing option for women who want to have a low intervention delivery, and a pediatric hospitalist team that's available 24/7 to take care of children in the hospital. This team has led to really great outcomes, including a C-section rate lower than the national average, early elective delivery rates lower than the national average, which decreases the likelihood that baby might end up in the neonatal intensive care unit. Additionally, we have extremely low central line infection rate, with only one central line infection in the last 11 years. We couldn't do anything that we do without the incredible people working here. We don't do this for us. We do this for you. We do this for our community. We do this for our families.
Young people entering the field of medicine today will see and do amazing things. We're a national leader in precision genomics right here from St. George, Utah. It's remarkable to consider all that's evolved from a handshake and a promise.
Someday, if I'm ever put on the witness stand, I'm going to, by Murray Webb or any of his ancestry, I'm going to have no trouble at all saying, we more than kept the promise.
So we appreciate and we don't forget the trust that Murray Webb placed in us to bring high quality healthcare here to St. George, world-class healthcare. And that's something we won't forget, that handshake and a promise. So we are a very innovative hub for Intermountain Healthcare here right from St. George, Utah. And nothing more innovative and exciting than what Dr. Lincoln Nadal is involved in with precision medicine. And we believe this is the future of medicine. And I want to share with you a story that he recently shared with us about a patient that we were able to help find a treatment for that was 3 years old at Primary Children's Hospital. So Dr. Nadal says about a year and a half ago, a 3-year-old boy presented to the emergency room at Primary Children's Hospital with uncontrolled seizures. He had been having seizures since he was born. The seizures were becoming progressively worse, so he was admitted to the ICU, and to control his seizures, he was placed in a medically induced coma and given 8 different anti-seizure medications to control these seizures. 3 years old. The care team contacted our precision medicine team and said, is this patient a candidate for rapid whole genome sequencing? We don't know where to go next with this 3-year-old. We're not making progress. And so Dr. Nadal and the team said, yes, we think this patient's a candidate for rapid whole genome sequencing. So we got a sample of the patient's blood, and we were able to sequence this patient's genes within 96 hours. We had mapped all 20,000 genes and 3 billion base pairs of this little boy. So 20,000 genes and 3 billion base pairs in 96 hours. So we found the genetic anomaly in that sequencing process. We found a genetic variant called the PROS-C gene. I don't know how scientists name these things. Good to see you, Dan. Thanks for coming. But apparently this gene is responsible for metabolizing vitamin B. So the team then were able to get this patient vitamin B, which is relatively very inexpensive. And this patient, within a short period of time that afternoon, was extubated and ended up being discharged from the hospital. That wouldn't have been possible without the ability to sequence genes. You think about that 3-year-old boy, and you think about the different aspects of his care from when he was born, the number of seizures, the number of times. I understand that this patient was in the hospital about 30 times during the short year of his life. You think about the emotional trauma and the pain and anguish those patients experience and this 3-year-old, and then you think about the cost. That's not inexpensive care to have that level of infrastructure around a 3-year-old boy. That's hundreds of thousands of dollars. So you see the solution is very simple. And science is making advancements like this, and we think with precision medicine we're just scratching the surface of what's possible. So we believe this is the future of medicine, and that example really illustrates that. But the Human Genome Project was about a 10-year project, and it cost about $3 billion. Now, if you participate in our heredogene study, you can do that for free. And so we're trying to identify the genetic variants in phase 1 for things like heart conditions and cancer is our initial focus. So we have geneticists that are involved in this, and we're putting a lot of money and time and effort into this because we want to get ahead of curing and treating to prevention, and we think that that precision medicine is the answer. And that is the hub for all of Intermountain Healthcare right here in St. George, Utah. So I want to credit Dr. Nadal and Derek Haslam for their pioneering efforts to bring that here to us in St. George. It's a big deal. So that is catching a lot of national and worldwide attention. And other healthcare systems are reaching out to Intermountain Healthcare to inquire about joint venturing or merging organizations. There's a lot of consolidation in the healthcare industry right now because healthcare is too expensive. And so consolidation allows for a couple of things that I think are really, really important. It helps us with pricing for supplies and equipment. When we're negotiating contracts for a healthcare system that's in multiple states, suppliers pay attention. And so the benefit for them is that they can get bulk or a lot of volume, and the benefit for us is we pay a lower cost per unit. Those are great economies of scale to help us in our efforts to make healthcare more affordable. That's one reason. But another very compelling reason is that things like precision medicine and Intermountain Healthcare's reputation is causing other healthcare organizations to reach out to us in other states to say, can we work together? And so we have just been through a significant merger with a healthcare system that has the same philosophies that Intermountain Healthcare does. They're not for profit, patients first. There are no shareholders. The money that we make gets reinvested in the communities that we serve. So this was a merger, not an acquisition, but you can now see with this merger with SCL Health, which is the Sisters of Charity of Leavenworth, a Catholic-based organization, that we're now in Montana. We were in Idaho, but we have more of a presence in Idaho, Colorado, Kansas, Nevada. We also have some services in parts of Arizona and New Mexico. So Intermountain Healthcare is growing, and we're being very selective about who we partner with, and that's about philosophically how we care for patients around a not-for-profit mission. So for many, many years, Intermountain Healthcare was just concentrated in the state of Utah. That has just recently changed, and I'm not sure where this is going to end. There are a lot of organizations that are approaching us about merging our organizations, so we're trying to be very selective and careful about how we do that. But we're growing. So combined, although we have lesser services in some states, it's really primarily 7 states that we have significant services in. 33 hospitals, including 1 virtual hospital. We can care for patients at home as though it were a hospital-based setting now with the technology that we have. 4,700 licensed beds, $14.2 billion in total revenue. Select Health is our insurance arm. We insure over 1 million people. We have 59,000 caregivers, 385 clinics, and 3,800 employed physicians and advanced practice providers. So that is rapidly growing. I want to come back to this idea that all hospitals are not created equal. And I want to be very specific about the role that a major trauma center can play in saving lives. And there's good data to support this. The state of Utah has a trauma registry, and they keep track of traumas throughout the entire state, and they put together an annual report. But this is, on the x-axis, there are 5 different trauma designations for hospital. 1 through 4, and then non-designated. You can be a non-designated trauma center hospital. But on the y-axis, you show the percentage of people that die, and these are case fatality rates based upon the severity of the injury. So basically what this data tells us is that if you have a serious traumatic accident, you want to be in a level 1 or level 2 trauma center. That's where the infrastructure is to save your life. That's why all hospitals are not created equal. If we are in some sort of a traumatic accident near Kanab, we go to that hospital. It's a great hospital. They provide great care, but if you compare what's done at the Kanab Hospital, what's done at St. George Regional Hospital as a level 2 trauma center, it's mind-boggling. So I want to share an example. I love to mountain bike. I coach the varsity kids on the Snow Canyon High School mountain bike team. So that requires me to bike a lot so that when I go to practice with these kids, I can still see them as the dust. They're fast and competitive, but boys and girls, and it's something I really enjoy doing. But I was out on a long ride on Saturday. I live in Santa Clara, and I was out in the South Hills. I'd ridden my bike out on some dirt roads out up to the caves up there, the Bloomington Caves. And then I came back down, and I was coming back over to the Bear Claw Poppy Trail. And I heard the helicopter, and without even looking up, I knew it was probably a Life Flight helicopter. And I saw the helicopter flying overhead, and it landed a couple hundred yards away from me, and dust was kicking up. But I thought, very confident in our Life Flight team and crew. And I thought, that person could have sustained a number of injuries, orthopedic injuries. There could have been a brain injury. But I thought, we have got everything that person's going to need right here in St. George. They didn't need to go anywhere else. Got neurosurgeons. You met Frank Bishop. They're there 24/7 to respond to brain injuries, brain tumors, spine injuries. There's a lot of infrastructure in a major trauma center. We're one of the largest trauma centers now in the state of Utah that gives us the best chance to save lives. So I think it's an important distinction, and when you present to a hospital, they're going to make the right decision for you. If you're in Kanab and you need to be transferred to a trauma center, they're going to do that rapidly and fast. We have good coordination and communication with those other hospitals to bring you here. So the other thing that's interesting about this is the next major trauma center, geographically, that has the infrastructure that we do here in St. George is in Provo or in Las Vegas. And most people prefer to travel north rather than go south to Las Vegas at this time. We're hoping to change that now as we enter into the state of Nevada. And I have a new role. I'll continue as the CEO of St. George Regional Hospital, but I also am the Chief Operations Officer over hospital-based care in our newly formed region in Arizona, Nevada, and southern Utah. So I have some opinions about the Las Vegas market, the state of Nevada, and what we could do to change the reputation. So, personal editorial, we transfer, there's not much that we transfer out of our hospital. When we do transfer patients out, it's typically in a couple of categories. One, children, subspecialized care for children. So I'd love to see a children's hospital in Las Vegas that was an Intermountain hospital, personal bias, obviously. And, things like, we had a patient that came in the hospital last week that had partially amputated hand. And that takes a lot of sophistication to reattach that. And our own hand surgeon here said transfer that to a level 1 trauma center. So quaternary level 1 trauma center stuff or subspecialized needs for children, it'd be great to see if over time we couldn't develop a strategy closer to home rather than traveling north to Salt Lake. But that has to be based upon our confidence in the quality of care of that hospital. So I hope to be able to influence that over time. Plus, in the winter, if we had to travel, I'd rather travel to Las Vegas than Salt Lake City. Although I grew up there in Salt Lake City, so. All right. But it's not only the clinical or technical aspects of the care that we deliver that it's important. It's the human compassion and kindness that's on top of that makes the greatest difference for our patients. We've had caregivers that have cared for patients in our hospital that came in the hospital without shoes. I've seen our caregivers take off their own shoes and give them to patients. I've seen caregivers run home because a patient's concerned about a pet that during an emergency they had to leave and there's no one there to care for their pet. I've seen patients credit our housekeeper for saving their life at our hospital. During the height of COVID, I was sent a 2-page single-spaced letter from a patient who was diagnosed with COVID and had a pretty severe case and decided that he was fine with letting it take his life. And you can see the difference in patients at our hospital who commit to fight. And you can see the difference in their care and their outcomes versus those who are resigned to just let the disease take its course. It's really interesting to watch that, but there is a very discernible difference. He had resigned to let this disease take its life. And we had a housekeeper that would come in every day, and we have these whiteboards that we use for communication. It has the patient's name, the doctor's name, and the nurse's name on there, and there's a section for communicating notes, but this housekeeper would write simply words of encouragement. Hang in there. You've got this. You're making progress. You're almost there. And so it was the clinical care as a foundation for his healing, but his mindset changed. He decided to fight because a housekeeper was leaving inspirational notes on the whiteboard. So, it's pretty emotional for me to think about, but every other Wednesday morning I take the opportunity to meet every one of our new caregivers, and I share this slide with them, and I talk about the importance of making that human connection. That we're hired for our clinical or technical skills. There has to be science behind what we do to be safe and to heal people. But part of the healing process really involves that human connection. And so it's really, really important. And it's important enough that I talk to each one of our caregivers about these two skill sets as we care for our patients. So we want to be big but small. We want to be big in the infrastructure we have to save lives, but small in the way we communicate with our patients. I now have the administrators at Cedar City Hospital and Garfield Memorial in Panguitch that report through me. And Garfield Memorial is a really small hospital, but they have really high patient experience ratings. And I think to myself, that's a bit of a paradox because we have the infrastructure to save your life here. There's 4 doctors on medical staff at Garfield. They're family practitioners, and they'll see patients in their office, and when a trauma comes into the hospital, in the ER, they cover the ER. They don't have cardiologists, they don't have neurosurgeons, they have general surgeons, but they provide a meaningful service to that community and to tourists that visit Bryce. But their patients are really happy. And so I watched that as a large hospital, and I asked their medical director, his name is Dr. Colin Marshall, I said, Colin, I love this, Well, how do you do this? And he said something that was powerful and profound and kind of funny. He said, every patient that comes in, we treat that patient like she's our grandmother. And oftentimes she is. But I refuse to believe that as a big hospital we can make those personal connections too. We can get to know each person that comes into our hospital. What are their hobbies and interests? What can we do to care for them? I refuse to believe that's not possible in a big hospital. So as long as I'm here, that belief and that focus will not go away. So we want to be a big, friendly hospital. And so we talk about our grounds crew looking up, making eye contact with patients and visitors and asking where they're going. How can we help you get there? Everyone that you see, I expect them to be friendly. And if they're not, you need to reach out to me and let me know. And we'll have a discussion. So our patient satisfaction is really high. These are surveys from our patients who've spent time as inpatients in our hospital. And our goal, I've challenged our entire team to create the kinds of experiences for our patients in our hospital that when they give us feedback, it would rank above the 90th percentile of any hospital in the country. And we're winning. I think over the course of 2 years, I think there's only been 1 or 2 months we didn't hit that 90% threshold. And I'm proud of our caregivers in that. That's that foundation of clinical and human skill that makes those experiences possible. I want everyone to have a great experience in our hospital that needs us. So, the greatest care in the world doesn't matter as much if no one can afford it. All of you have this belief that healthcare is inexpensive, don't you? Healthcare is too expensive. Healthcare is too expensive, and we all need to work together to improve it. And I think a foundation of that is, as I mentioned earlier at the beginning of my presentation, take the time to make a commitment to take care of yourself. There's so much you can do to prevent yourself from needing our services at the hospital. But when you do, we'll leave the light on. We're always there, 24/7, but I'm a huge proponent of making a commitment to take care of yourself. We all have our own stories in that journey. What catches our attention at what age. It's different for each one of us. It's very individual, but make that commitment. But healthcare is too expensive. And so I want to talk a little bit about some of the things that Intermountain Healthcare and our hospital is doing to make healthcare more affordable. So our Health and Performance Center on your left here. This is something that Dan Nilsson and the Coral Desert Ambulatory Surgery Center do very well. They have great surgeons there. They have great screening criteria for safety and quality and good outcomes. And so these are surgery centers for very simple elective surgical procedures that don't need to be done in a hospital. And we have a collaboration with the Coral Desert Surgery Center. And you can have surgery done in an ambulatory surgery center at a much more reduced cost than you can in a hospital. So we partner with Coral Desert Surgery Center, and we, on June 8th, have just done our first surgical case in our own ambulatory surgery center. And I appreciate Dan's support. We're working together really to provide this care for our patients. We're very aligned in doing this, but our patients, I think, through these offerings, through Coral Desert and through Intermountain Healthcare and St. George Regional Hospital, we can provide elective surgery, simple surgeries at a much reduced cost. That's an option now. And we're proud of that. We also are going to be developing an outpatient radiology imaging center in our four-master building to make imaging procedures and radiology procedures a lot more affordable than if you're in the hospital. If you're in the hospital, you're typically the level of care that you need is much higher, and so I don't ever see us in the hospital being able to reduce our rates to what we see here for a lot of different reasons. But we are providing much more affordable healthcare and imaging and surgery now as well through the hospital. So I think it's a great example of what we're trying to do to reduce the cost of care. We need to make healthcare more accessible, so I know that in 2019, Mayor Bramwell reached out to Terry Draper and I and asked to talk to us about the healthcare services that Intermountain Healthcare is providing in Hurricane and encouraging us to look ahead and provide more services. Because that's a very rapidly growing area of our county as well. And we see a lot more land out there than we do in St. George. And so he was concerned. And I said, what do you need? What do the citizens of this community need? And he said, we need access to care 24/7 because we have close proximity to the park, to Sand Hollow. And unfortunately, a lot of people visiting from across the country get injured and they need rapid access to health care. Well, when we talk about access to health care 24/7, to us, that's a hospital. That's an emergency department. So we're right in the midst of building this facility. And the second thing he said was, don't do anything to increase the cost of healthcare. Try and make this as affordable as possible. So we begin with that priority. How do we do both of those things? How do we provide access to care 24/7, but also not dramatically increase the cost of healthcare? So we are building hospitals now very differently than we did in the past. We start with a footprint of an emergency department. It has imaging capabilities, telehealth capabilities, lots of technology here. And then what you do is you connect that into our trauma center here in St. George. So patients that don't need to come to St. George shouldn't. They shouldn't come to St. George. And you can get a consultation from a cardiologist or a neurosurgeon or a general surgeon right in Hurricane from St. George. So our goal is to keep patients there when it's safe and the care that we have to render there is supported. But when patients still need to come into the trauma center, they're still going to come here. So we're trying to strike that balance, and this hospital is actually designed with a whole surrounding footprint for beds and surgery, but it's designed in different phases over time so that we don't have to increase the rates of health care to make it doable. So it's a teeter-totter in a way, but this hospital is designed to pivot. We can add beds, we can do surgery, we can do deliveries of babies, but we knew that if we did that out of the gate, we'd lose money and would have to increase the cost of health care, and that's not a good thing. So we're trying to respond to the community to do both. It's tricky. That's this is supposed to be completed in the first quarter of next year. I just learned through a text that there's some piece of power equipment, Terry, that's going to delay us 3 more months. So it's just like, oh my gosh. The supply chain, these things. So it was supposed to be done, and we're working with Jacobson Construction. It's supposed to be done in March. I think this delay, unless we can get it resolved, it's looking like it may be June. But anyway, that project's well underway. Okay, so Connect Care. Healthcare in an episode with your health is never convenient. It can occur at 2 or 3 o'clock in the morning. I think about our children, and I think about the decisions we make about, do I really need to go into the emergency department? Or, you know, if my primary care clinic's not open right now, what do I do? Well, Connect Care is a good solution. Within moments, you can be connected with a provider, a physician or an advanced practice provider. Those are nurse practitioners or physician assistants. You can be connected within minutes or seconds, and you can be receiving a consultation through that technology, and it's at a much reduced rate, $59. Just pull up your app and access that, and you can get answers to questions. That's another example of how we're trying to make healthcare more accessible and more affordable. Great solution. So Select Health is our insurance company, and they have made commitments to certain employer groups that they're going to cap the premium rates, those increases. And so for 2 straight years on the individual market, our premium reductions have actually gone down 2%. So I think that's also part of our not-for-profit mission, but we're trying to make insurance more affordable, premiums more affordable. So we also have a lot of patients who come into our hospital, and we would say that they're there a lot. And we're trying to understand why they continue to come back to the hospital. So we funded a study called the Social Determinants of Health to figure out, for a population of patients, it was for Select Health Medicaid patients, why do some of these people keep coming into the emergency department to access health care? There's so many other less expensive solutions. And so that's a whole nother dynamic. We hired community health workers, and they get to know these patients, and they go into their homes and they see their living conditions, and they talk about things like food and transportation and hygiene and how do you access a physician. That a primary care physician to many people is like, I don't even know what that is. So we're spending a lot of money to help people who can't afford health care to access health care at other places other than coming to the emergency department. That's not, I mean, if you go to the emergency department, you pretty much want to make sure you need the emergency department, because it's not cheap. And I can't have the infrastructure that we have in the hospital without it not costing me a lot of money. The cost to recruit the neurosurgeons, the general surgeons, the orthopedic trauma surgeons. We have orthopedic surgeons now at our hospital. All they do is care for patients who come in through the emergency department in the hospital. They don't have an outpatient practice. Care is becoming so subspecialized. We have orthopedic surgeons, all they do is hand surgery. Some do joints, hips. It's becoming so highly subspecialized, and that's a good thing for all of us. But to recruit the very best from across the country, they have high expectations. So it's a balance, and that's where I think this not-for-profit mission really helps, is that the money that we do make gets reinvested into the community that we serve. We expand the size of the hospital, we purchase a new piece of equipment, we recruit more physicians and nurses. No one owns shares of stock. There are no shares of stock. We're salaried employees. And so the money that we do make goes back into technology, supporting precision medicine, hiring more nurses, supporting healthcare in our community. So, and I talked about lowering the cost of care for our procedures, and we're doing that by lowering our pricing, having an ambulatory surgery center offering, and also an imaging center to lower the cost of care there as well. This is really cool. There's nothing in healthcare that's more expensive than drugs. So Intermountain Healthcare, I think Mark Harrison, Dr. Harrison's our CEO, he decided we're done with this. And so he formed a consortium and brought a lot of healthcare systems together to form this Civica. And basically what we're doing is I'm trying to think the best way to describe this. We're in the business of selling drugs. And so we look at some of the most expensive drugs across the country, and we're doing them ourselves. We've decided to kind of skirt the expense of some of these drug companies and say, as a not-for-profit, we're going to do this cheaper. And so we're making drugs more affordable for patients in our hospital, and even we're expanding that list of drugs that are available to serve the communities, because they're just way too expensive. And the profit margins on some of these drugs is very high. So I really applaud Intermountain Healthcare's efforts and Dr. Harrison's vision to make drugs more affordable. And now we're announcing that we'll now produce insulin. So every drug that we produce is going to be at a much reduced cost. So that's really kind of leading industry there. Yeah. Way too expensive. And when you come to our hospital as a not-for-profit, regardless of your ability to pay for the care, we're going to take care of you. And therein lies a difference between, I think, for-profit hospitals that are owned by shareholders versus not-for-profit hospitals that don't have shareholders. Is that we have processes in place to evaluate a person's ability to pay, but if you can't pay for it, it's written off. And so on the back of our patients' envelopes, there's a phone number, and we encourage them to call and talk to us about their health care and the cost of it so that we can help them. There's a lot of different resources to help people pay for their health care. None of us can afford it. It's too expensive, and so there are resources, and so people will come in and they'll ask us questions about that, or we're proactively telling them what services are available for us to help make it more affordable. So every patient that comes through, we're going to take care of you, but we're also going to talk about how we can make it as affordable as possible. So through that process, over the course of a year, this is what that means to our hospital. We've helped almost 20,000 patients. We've written off $23 million through that screening process, where we just simply say, you know what, we see you can't afford it, and we're writing that off. That's once a year. I have to go to the county commissioners, and I have to report what we're doing to warrant our not-for-profit status. So what we have to demonstrate to the government is that we are providing more in charity care than would pay in taxes. So rough guess here, here's a trivia question. This last year, this is not bad debt, this is pure charity care. We just wrote it off. Patient didn't have to pay for it. $23 million, how much would we have paid the county in taxes as a hospital, property taxes, if we would have? Any guesses? 17 million? Lower. 5 million, about $5 to $6 million. So every year we want to come back and demonstrate that we've done that in multiples, because that's our not-for-profit mission. We're going to take care of you regardless of your ability to pay. Now that doesn't mean that everyone can come in and we just say, okay, you can't afford it. There's a process, right? We have financial advisors and patient advocates, and we ask questions and we look at information and we make a decision together about what we write off. So I want you to know this is available to everyone who comes into our hospital. So we're also involved in supporting our community and community health. And so last year we made donations over $750,000 as a hospital to these entities to further our mission in helping people live the healthiest lives possible. So we are the largest, I think, employer in the county. And so I think about just sheer number of people that work at the hospital, either volunteers or physicians. We have over 400 physicians on our medical staff now. That doesn't include nurse practitioners and physician assistants. And so when I think about the sheer number of people working for Intermountain Healthcare in St. George, it's 4,000 people, 4,000 people. It's a lot of people. These people live here, they shop here. It's good for the economy, although none of us can afford the inflationary prices right now. I understand that inflation's higher than it's been in 40 years, and so we're all losing sleep over that. It's very concerning, but we recruit people here from across the country, and we reinvest money in this community as a not-for-profit, and we keep our spending locally to the extent we can. So we contribute to the economy here. And we get feedback from members of our governing board. You may recognize some of the people on our governing board, but we value that relationship because they are the voice, another voice back to us as a hospital for how we should be providing care to the communities that we serve. And we appreciate their support. So I just want to conclude by renewing our promise to this community that we made to Murray Webb, and that this commission from Victor Brown to be a model healthcare system, that we feel confident we're doing that here. We see a whole lot more ahead of us over the next 15 years. In fact, that's where my attention's turned, as we've hired some consultants and we're now in the throes of our planning efforts to see what's next for the next 15 years, and there's a lot ahead of us here. I mean, for the second time in a row, the U.S. Census indicates we're the fastest growing metropolitan statistical area in the country, and you just drive around here, and the growth is staggering. So that's keeping me up at night as well from a healthcare perspective. And usually when people come to move here, particularly if they're 65 or over, the first thing they're looking for is, what's the hospital like here? What's healthcare like? And so we have realtors that reach out to us a lot to talk about that and how to share what we have here in with the people that want to move here. But I've traveled the country. I've spent time now in Las Vegas and New York, and I can tell you that I'm very confident that we have a very good hospital right here in St. George. There's more we have to do. We're not perfect. Healthcare is too expensive. And despite our best efforts, there's sometimes when we can't save a life. But the commitment's there, the vision's there, the passion's there, and what we have here relative to what other communities have throughout this country, I think, is remarkable. So, yeah, good. We have time for some questions if you have any, and then we can wrap up. Brad.
If you're going into these other states, are they going to be branded as IHC, or are they going to continue to be branded as...
Yes. Now, Brad, let me tell you something about IHC. Every time, when we did a rebranding effort, every time we said IHC, there was a big jar on the table. We had to pull out a dollar bill and put that in the bucket. So when I hear IHC, I think about, my gosh, I got to get my wallet out and put a dollar in the jar. But so Intermountain Healthcare. Yes, it's going to be branded as Intermountain Healthcare. There are some of these hospitals with Sisters of Charity of Leavenworth in Colorado and Montana that have a deep history in the name of the hospital, and so that has a very Catholic origin, and will preserve those, but the healthcare system name will be Intermountain Healthcare. Yeah. And that's a nationally and globally recognized brand name, and so I think that hasn't been an issue with organizations that we merge with. They get it. Yeah. Yeah.
Sorry. What about, so you showed the insulin, for example. Does that mean that those drugs that are being produced will be sold in the pharmacy at the hospital? Or do those go out to other pharmacies?
Both. Yeah. Yeah. Yeah.
Are you experiencing any shortages of product?
Yes.
Items?
What was the latest one? It seems like there's always one. It was the canes, yes. The canes. Yep. And that's a shortage across the country. And those ebb and flow kind of all the time. Yeah. Don't get bit by rattlesnakes, because if you need to come to the hospital, that's a really expensive antidote. Oncology drugs are incredibly expensive as well. Yeah.
So you mentioned the campuses out in Hurricane and whatnot. What is happening with expansion of your space here in St. George?
Yeah, all right. We just added 10 more beds. We just opened up 2 more operating rooms in the hospital. We're just opening up our ambulatory surgery center. We are planning, we've submitted a proposal to build out 32 more beds in our hospital. We're 294 licensed beds. We've got to add another 32 within the next year or two, and even more beyond that. So You know, I think about it's not going to be in the far too distant future where our hospital will have like 400 beds. Yeah, so there are a lot of other different, we have construction projects happening all the time over at the hospital, but those are some of the most recent things that we've been doing. Yeah.
So do you have an active mergers and acquisitions team? How did this
We do.
charity level work come about?
Yeah, so there's our reputation was, I think, first and foremost, and the ability to consolidate, to take advantage of economies of scale and purchasing power. Best practices, evidence-based medicine practices, and our reputation there. But Dr. Harrison, our CEO, we have a strategic planning group in Salt Lake, and they filled all those requests, and we have a list of criteria that we go through. How focused on the patient is this organization? What's the reputation for safety and quality is where it all begins. And usually that's wrapped around that not-for-profit mission. But there's a lot of screening criteria to make sure that our cultures blend rather than conflict, because that would be a disaster. So there are probably, I heard a couple weeks ago when I was talking with a member of this team that we're fielding over 20 serious requests right now from other healthcare systems to merge, form, acquire, different ways that we do that. But it really is a nationally and globally recognized healthcare organization, and people are wanting to be a part of it. So, okay, that is all of our time. I want to thank, I have a lot of respect for Brad, and I want to thank you for allowing us to come here and talk about healthcare and your health, and please, one last plea, take care of yourselves. Thank you.
Which usually goes high when I have to get up in front of everybody. But I will say this, I'm a pretty private person, so I'll just take 30 seconds. I'm pretty private. For the first probably 20 to 25 years of my life, I had no idea who my doctor was. I either didn't have one or I just didn't care. But over the last 10 years, I think between myself or family members, I spent enough for 10 lifetimes in the hospital. And I've always had incredible care with IHC, even to the point where one of the times where we were in there, Mitch and Dr. Carroll even came in to say hello personally. So when they're talking about wanting to give that personal touch, it's there. So please give Mitch another thank you and Terry. And then just one last thing is, remember, if you're posting on social media, anything like that, please tag the Hilton Garden Inn. Thank them for hosting, and we will see you next week at our next luncheon. So thank you.